tend to suffer from common headaches that tend to be a band-like distribution across the forehead, as they tend to come on commonly, usually after working for long hours, being seated for a while, well, then you may have what we call a tension headache. Thank you for tuning into our channel where we aim to give you, the patient, the most up-to-date, evidence-based information. Today we will be covering tension headaches. Let's start off with our main question. Do patients with consistent tension headaches have more muscle hypertonicity or tightness in their neck as well as more neck pain? Some of the other topics that we will be covering today are: what is a tension headache? What is the difference between a migraine and a tension headache? How can tight muscles in the neck cause tension headaches? How can neck pain cause tension headaches? And how can chiropractic care help with tension headaches? So let's first go over what a tension headache is. A tension headache is a common type of headache, usually characterized by a dull, achy head pain. It is usually accompanied by pressure around the forehead, sides, as well as the back of the cervical or head areas. It is often described as feeling as if there's a tight band around the forehead. Now, these tension headaches can be categorized based on their frequency. The first one that we have are what we call episodic tension headaches. These usually occur less frequently, roughly less than 15 days per month. They last around 30 minutes to a few days, and they're mild to moderate on their pain levels. Now, a chronic tension headache usually occurs more often, more than 15 days a month, and has occurred for at least 3 months. This pain is persistent and constant. So what is the difference between a tension headache and a migraine? A tension headache is characterized by a constant, dull, aching pain. It has a band pain distribution across the forehead. It is linked to muscle tension, stress, and poor posture. A migraine, on the other hand, is more severe, pulsating type of pain. Usually the pain is located on one side of the head and may have severe symptoms such as nausea, as well as light and sound sensitivity. So how can tight muscles cause tension headaches? There's a couple different ways that this can occur. The first one is through muscle contraction and strain. When muscles are tight or in a state of prolonged contraction, they become strained. This strain often leads to discomfort and pain, which may be the leading cause of a tension headache. It is important to note that the muscles in the neck, head, and scalp are often tight and cause the onset of a tension headache. The next way is through trigger points. If muscles are tight, they can develop trigger points. Trigger points are localized areas of tension within a muscle. These trigger points can often cause pain referrals to other areas such as the head, neck, and the forehead. And the final way that tight muscles can cause tension headaches is through reduced blood flow. Prolonged muscle contraction may reduce blood flow to certain areas. This in turn leads to depleted oxygen levels in the local vicinity. Decreased oxygen can not only cause pain, but also difficulty concentrating during an episode of a tension headache. So how can neck pain cause tension headaches? Neck pain is often a frequent complaint from individuals suffering from either migraines or tension headaches. Roughly 88% of patients with tension headaches have neck pain. It is also interesting to note that there is a positive correlation between the severity of neck pain and the frequency of these headaches. A study performed in 2006 observed the natural posture of patients with chronic tension headaches. The study found that patients suffering from these chronic tension headaches also had a more pronounced forward head posture, as you can see the picture up above. Forward head posture is a mechanism in which the body guards itself from pain. However, over time, forward head posture may be the promoting factor in causing neck pain, which ultimately can cause these tension headaches. The more pronounced forward head carriage is, the more strain is placed not only on the cervical spine, but the muscles that support the spine as well. Both of these factors in combination are partially responsible for causing tension headaches in certain individuals. Now, when it comes to treatment for any tension headaches, before any treatment is performed, it is imperative to take the proper steps and rule out any severe pathological variables that may be causing these headaches. Your practitioner should always make sure to rule out any of the red flag signs that may be associated with these headaches, and there's a picture up above below that you may pause the video to read. So how can chiropractic care help with tension headaches? The first is through spinal manipulation. Manipulation of the cervical spine has been shown to help decrease the frequency, severity, and occurrence of tension headaches in individuals with primary tension headaches. Now, a primary tension headache is a headache that comes on with no known cause. And this can be no pathological underlying cause for these types of things. Now, this could be including any of the tight muscles that we talked before, any of the posture, any of the forward head carriage. This is a primary tension headache. The second way that chiropractic care can help with tension headaches is through muscle relaxation and stimulation. Manual therapy is often a technique applied within many chiropractic practices and aims to provide relief from pain caused by hypertonic or tight muscles. These tight muscles are often a pain generator for the onset of tension type headaches. And the final way that chiropractic care can can help with tension headaches is through posture improvement. Poor posture is known to contribute to the onset of tension-type headaches. Chiropractic physicians often work with patients to help offer guidance on proper posture and ergonomics for both at work and during their daily activities. This can help reduce the frequency and severity of these tension types of headaches. So what are some preventative measures for tension-type headaches? The first is to make sure that you get enough sleep. Ensure that you get around 7 to 9 hours of quality sleep per night. Poor sleep hygiene can trigger these tension headaches. Second way is through exercising regularly. Engaging in regular physical activity can help reduce muscle tension and improve overall well-being. You want to aim for around 30 minutes of moderate activity 4 to 5 times a week. This activity can be as simple as a brisk walk during those days. The third point is to make sure you stay hydrated. Dehydration can contribute to headaches. Make sure you are drinking an adequate amount of water daily. So what is the adequate amount of water? For women, it's roughly 90 ounces of water, and men 128 ounces of water. Now you want to make sure that you add 16 ounces of water on top of this for every 8 ounces of caffeinated soda or sugary drinks, as these tend to dehydrate you throughout the day. The final way is to maintain good posture. Be mindful of your posture, especially if you spend long hours at your desk or a computer. Ensure that your workstation is set up correctly to help avoid these tension headaches. Now that's all I have for you today. I hope this video was helpful and informative in guiding you on how to get treatment and avoid tension type of headaches. If you found this video helpful and informative, please like, share, comment, and subscribe, as it is the best way to support our channels. Thank you and have a wonderful day.